5:34, and I will call the July 10th meeting of the Ayer Board of Health to order. Public input looks a little sparse tonight, so
unusual as it is.
I know, it's very rare, but we'll forge on ahead. So we do have some minutes.
Madam Chair,
Yeah.
last meeting,
Yeah.
I specifically brought out that we were missing the minutes of June 12th, I believe it is, and we still don't.
12th.
Yeah, we've never done them.
Yes, we have. Let's see.
No, we haven't.
That was a Tuesday meeting? That
No,
you had?
no, it wasn't. It was the meeting. In fact, Tricia, that was the meeting where you said, "Oh, I won't be here on the 26th because we're going away."
I have here review of minutes. May 15 was approved, May 22nd approved
Correct.
with changes as noted. May
Yeah.
30th pending changes and 6/12 pending changes.
We never got 6/12. I put it down on my agenda last time when we were reviewing the minutes, and because we had to make some changes, and I said we don't have June 12th. They were not done. I put this down on the 26th.
Well,
So
I ran out without my whole
Well, that
package
was
of stuff.
that was the public hearing.
no, it was. We finished.
No, that would have
No,
been a regular.
it was a regular meeting.
Yeah.
It was June 12th.
June 12th.
Although
The second continuation of the public hearing. Yeah, it was continued.
We
Yeah.
continued
Yeah.
it. No, we continued that. We had the public hearing. We started June 22nd. And then we had May 30th, which was the Tuesday. And then on June 12th, we had the one thing that you wanted, which
Yeah.
was the permeable pavers, the
yeah, we had a little
explanation
bit
of
of that. Yeah.
And then we approved it. We had then Bridget's information, Sawyer, a timeline for odor elimination that had been submitted. A follow-up on Bly Street, and you said the sale was
Yeah.
going through, the food inspections. We had minutes of the 15th on that night, and that's when we first brought up the new DEP regs, which regards to
Yep.
It's
letter to House Speaker regarding tobacco. Are they changing the age to 21?
Yeah.
We discussed, in fact, you gave a little, shall we say, scolding to people that get
Oh,
on.
that's right. Yes.
Get on their Facebook.
That's right. I did.
And,
Yeah.
It
Yep.
never went to
Yep.
the public meeting that they had at the school with regards to the water problem at the
Right.
Page Hilltop and what was being done. You brought up the problem with the gypsy moth caterpillars, ticks in general, a new form for reporting elderly abuse, what Case was doing, Wright Road water main, we had bills, first quarterly bill from the Neshoba Board of Health, a new rate for administrative assistant, and the dues for our dues for Mass Boards of Health. So, and that was when you said to Trish, I won't hear on the 26th, and then due to family emergencies,
Yeah.
you ended up being here. So we still do not have those minutes.
I'll check on
Okay.
those. I think I've
Yeah.
read
Maybe
them,
you.
but maybe I've overlooked. I've just had a lot of meetings and a lot of.
Either that, or you might have done them. And,
I don't think so, because when
No.
we
I mean, I
reviewed
think
them-
she might have done them on her computer, or at least started them.
Yeah.
Because
and maybe
like I
they
said,
didn't-
I'll
yeah.
check.
I
on
brought
that.
it up
Yeah.
so that we would.
Now, I'm going to ask a really dumb question. Is June 12th. That's not the extra meeting we had.
No.
No.
This was our regular meeting.
It was this
Yeah.
one.
Yeah, we just did a little bit at the
Okay.
beginning.
Don't look at my
about
We
notes.
just
31.
finished up
My
with it
little
notes.
because you had
Yeah.
that,
It was the continuation of the special.
what?
I wonder if I,
Basically,
Just
this
have
was
them
our
on.
regular meeting on the 12th.
It's this
Yeah.
one.
Yeah, it was our regular meeting, and the only thing that we had was,
We put that first.
we put the one thing first, because we had already had 2 nights of that other, and you had asked the question
Yep,
and
that's
et
right.
cetera,
Right.
so anyway.
Okay, we'll figure them out.
Yeah.
We'll,
Yeah.
we'll get them done.
I
So
think I've
we-
already done it, but I'm wondering if I screwed up on the date of one of my minutes.
Well, when I brought it up, you didn't respond like, oh, I forgot to bring them, or I think I
Yeah,
got them, but
yeah.
I didn't print them, so anyway.
Yeah, you know, the other interesting thing, Jane, is maybe we did just miss them because in the minutes of June 26th, which you have in front of us
Right.
tonight to review, that would have been the only meeting where we could have reviewed those minutes, and it's
We
not
did.
listed in the review of
We
minutes.
did,
What?
because it says review of minutes, it says 6/12 pending changes. So
No,
we did-
I don't think
We
so.
talked about it,
I don't think so.
because I wrote, right there, Mary, the
Well.
2 of them, I wrote pending changes.
I brought it up. The pending changes were the others because of the question you had asked.
We'll figure out.
Well, we
There
need
were the
them.
minutes that I sent back to you, Jane, but I think those were more about the special.
Yeah,
Yeah.
I'm not gonna speak to
Yeah.
it without
Yeah.
It
having.
just,
Yeah,
Because
and I didn't bring my
I've
usual
been a
big
minute
pile.
queen lately, and one set of minutes kind of blends into the
We'll figure
next.
it out.
well,
We'll figure it
anyhow.
out.
All right, all right.
So tonight we have, so review of minutes.
Let me get my tonight's here.
So the ones that we modified that I have here for tonight are May 22nd. That was the one that we just needed to change the signature lines and
Oh,
stuff
okay,
around.
yeah.
Yeah. So I have a
I
clean
know.
copy of those.
Well, we had approved them
Yeah, right, we said we were gonna sign them with,
with the
We just
clean
needed
copy.
to-
Yeah, yeah.
so,
Here, and these are the ones to sign. For some reason, I've got them in this folder, because it's better not to sign the ones that are printed on 2 sides.
okay.
So,
So-
these are the ones,
To be signed.
So you want us to sign?
Unless I made 2 copies of, say, I did
Public
this last
hearings.
week, I
So,
No, I think these were mine.
so this was
This is
the,
the copy I.
this is the 22nd,
Yeah,
okay.
these are the ones that we said we were gonna sign with.
Was the 22nd, and then where's the 30th, or did we already sign those?
That said
Um,
pending changes.
Yeah, these are the minutes from the 30th. They were in the to be signed.
So that's the one that was, it said pending changes. And what was the change?
I don't know what these pending changes
The
are.
signature line.
I think it was just a
Was it
signature
just a
line.
signature line for that one too?
Yes,
Um,
I think so. Hang on. Let me go here.
And May
I think there was
22nd,
something else, but it was a minor thing.
May 22nd, Pam, I have that they were approved with changes as noted.
Yeah.
On June
Those are-
26th, we
They're
approved
the
the,
ones for the 30th.
we approved the
So-
16th and the 22nd.
Right,
on-
the 22nd, we just needed a new signature line.
So we have the 30th and the 12th that we need to
So
do.
they're the ones that we already said were okay. These are fortunately
But we were the,
pretty short.
Where's the 30th?
I have it
Okay, so,
right here in my hand.
but I haven't seen those yet, I don't.
No, I don't think you sent those out with,
No,
um,
I'm giving you this because there's too much flying back and forth and
okay. So those are the 30th. Okay, so this one I already have a copy of. This one we can just kind of get rid of.
All right,
what's this?
this is for you.
Those are the ones that we said we were going to sign with changes. We just
Okay.
needed new signature
Okay.
lines. And then, so we also did, so this is going back in the to be signed folder. This, okay, and then this you already have.
Yeah.
So I'll just leave the, or do you want me to pull it out?
Oh, no, that's to be signed. Oh, yeah, no, I already have the one with your signature. I just
Okay.
put it- I
So do you
just-
want me to pull this one out and toss it, or?
Yeah, you can. Yeah,
All right.
yeah, I just put that in there because.
Yeah, right, I hadn't given
Yeah,
it to you yet.
right.
Okay,
I just printed it out.
all right, so the May 22nd meetings or minutes are going back in.
No, it's the June 12th.
Nope, the May 22nd ones that we just needed the new
Oh,
signature on.
yeah.
So that's I'm gonna put that back
In
in
the
the to be
folder.
signed.
Oh, okay.
Yeah.
Back in.
Yeah, we have,
Okay, then we're getting a little off.
May-
Tell me, this is the.
that's May
20
30th.
All right, this is
That's the continuation.
the last, let me see. Okay, this was the one where I made the motion to continue it to June 12th because you had those couple of questions.
And then we just did that very quickly.
Okay,
at the
so
beginning
this
of
just
12.
needs to be signed.
Yes.
All right.
Yeah. So that was the May
Okay.
30. Okay. Then we have June 26th, which did get sent out. Okay, so these are going back in the folder. And did Mary, you and you, Tricia, you got the June 26th ones?
Yeah,
Yep.
Okay.
yeah, they're the ones. that
Okay,
come
you okay with
out.
I
that? Or-
printed out, yeah.
Okay. So are we
Yeah.
okay with those, or
So,
do those need any change?
So the 30th, we had just signed, right?
Yep, we signed the 30th, and we signed
That was
the
the,
22nd.
So we're just checking those.
okay.
And next, we'll catch up on the ones from the 12th.
Okay, the only thing and maybe we could explain it later on in the meeting, is a little explanation as to what that house 1112 is. Because if you just read this,
Mm-hmm.
it looks as though, why is the Board of Health against something that improves the economy and housing?
I see what we're saying.
Yeah.
Yeah.
Because basically what that bill is, as I understand it, and was in the paper, this, if you had a big plot of land and you decided that the town, were going to come up with a plan, maybe keep it for open space, etc., it would allow a developer to apply and say, oh, well, I'm going to put some housing in and override local zoning. And that's why I think we were all in agreement
That was the
that is
issue,
vehemently.
Yeah.
So I think, I don't know if there's a better way to explain that, but
Is the bill, could we put something on the website that shows is the language in the bill?
I mean, that's specifically, and I don't want to, name the community that this started, but you know that if there's a big plot of land,
Right.
a developer, he's thinking of the Benjamins.
Mhm.
So this would give him a way, if you had it, to go to his local friend, whoever, the state senator or state rep, and say, hey, you remember that square I'll give you the money to dedicate that to somebody, and I'm going to take that, I'd like to take that 100 acres and put affordable housing in there, which means they clear cut, knock everything down, put as many buildings as they could, dedicate a few as affordable, and the others would be market rate, and there would go your land.
So you'd like an explanation of how our role,
No, I just think,
it addresses this bill, so that anyone reading it will go, well, what the heck are they getting involved for?
well,
Yeah.
exactly, but
What we could do, because we're going to sign the other letters tonight, is we could put in the minutes from tonight.
okay,
a
that's what I would like some
Yeah.
clarification
Yeah,
on,
yeah, okay.
So
So it's actually, it's that bill which,
takes away local control.
yes, would have taken, right, allowed the overrule of local, more protective ordinances and regulations.
When we did the Willows
Yeah,
down there, now that was a special permit, and there was some affordable housing. We had tons of meeting. Everybody came, I mean, the school, the conservation, the board of selectmen, the board of health, everybody. And I can tell you that their original plan and what's down there now, two different things.
Yeah, two
and that's
different
because
things, yeah.
people came out and spoke and said, whoa, 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 wait
Yeah.
just a minute.
yeah.
No.
Yeah, you actually can take the language right out of the letters.
Yeah.
It's actually in that very first statement, which would allow the overrule of more protective local environmental and health ordinances unless those local requirements are approved by the DEP. So we can just add a clarification that we signed, these additional letters.
Okay. So then, if that's all right, well then we'll approve the minutes of May 30th, June 26th, and June 12th we have to have, yes.
Yeah, June 12th we'll have next week.
Okay,
Yeah.
all right.
Yeah. Okay, so we're okay with June 26th meetings?
Yes.
Okay.
Yeah. I did make that motion.
Go.
Oh, I second.
Yeah, second, okay, all in favor?
Aye.
All right. So that's,
All right.
Well, there should be 3 sets of minutes.
yep, May 22nd, May 30th, and June 26th.
Okay.
But 2 of them we had looked at in some
Right.
form or another and
Right.
voted on, yeah.
Okay.
Okay, so, let's set there. Minutes. Whew. That was confusing. Okay, let's talk about rock and roll,
Okay.
or food
Whatever.
or
Well,
whoever they are this week.
Still says rock and roll everywhere. so
Yeah, it's,
whatever.
the owners have
Update
changed.
us.
But the sign remains the same. Well, I was going to look in the initial material to see if there is anything.
I didn't get anything from her this week.
Okay, no
She didn't
inspection?
leave me anything.
Okay,
She
so
took
there's
some
nothing new in
things,
the
so she was
inspection
here this
reports.
morning.
Yeah. Okay, so then I'll give you the update based
Please.
on my conversation with Bridget this morning. So, she made the point that at this inspection, she made them throw away what she estimates to be
Right.
in excess of $1,000.
Well, you had said
Which-
she made him throw away everything.
I hadn't heard a dollar figure.
No,
that got
She
my
said
attention.
considerable.
Yeah.
Yeah.
Considerable was over $1,000
Yeah.
worth. So she has been back in there twice.
Okay.
Apparently, we're not still quite up to snuff. We're doing the slow improvement thing. They are on an accelerated inspection schedule. I made it clear to her that she has the full support of the board to do what needs to be done. She has been in there twice since then. We just don't
Okay.
have the reports. And she's going to continue to go in. And she is probably going to do an evening inspection at some point.
Excellent, excellent, because that's what we discussed.
Yes, yeah. And I told her that if I can make it, would be really interested in going on one of these inspections. Apparently the gentleman that, he's not the owner, but he's the guy in charge there, when the restaurant is open, was very upset with her. It was a financial thing, a lot of food thrown away. That's the way it is.
Do your job properly, you wouldn't
Exactly.
have lost it.
And said that Ayer has been very hard on them, very difficult to do business in Ayer.
Really?
So I said, well, then I would love to be there, because let him take his, he sees you all the time, Bridget, not
Yeah.
to diminish
No.
what you do by any means, because I don't know the rings the way she does. But if he wants to take his case to the chair, we're not asking them to come before us here, because we're not really interested. We just want to see improvement.
Been there, done that.
But I'll go there, and if he wants to voice his complaint to me, he's more than welcome. But all I can tell him is what Bridget has already told him, and that's that he has to follow the same rules that every other restaurant, not just every restaurant in Ayer, not just every Chinese restaurant, every restaurant. The sanitary code is the same for the entire state. So I would be happy to reinforce that. So we'll see. She's going to contact me before she goes in for the next one. But that's the story there. It remains a work in progress. They are getting charged for the additional inspections. And she is working with Jim and with the state on it, because she wants to make sure that if, the next step is a shutdown, that's done in, the appropriate manner. So I said, yep, if that needs to be done, you most definitely ought to support.
So how often has she been going?
She's been back twice, and we'll be doing another one soon.
Okay.
So that's kind of all I really have about rock and roll. But the thing that I was encouraged by was that she's on high alert, Jim Bareffi's on high alert, apparently everybody is on high alert except the people at rock and roll.
And these are unannounced.
Yeah, they're unannounced. Yeah,
Oh,
yeah.
just walks in.
Yeah, she just walks
That's
in.
the only way to do it.
Yeah, she walks in. She walks in the back door sometimes. So, and which she can do by law. So to be continued. I suspect that'll have a
If you knew anybody
continuation.
was coming in, you'd be,
Oh, of course.
especially
That's
it's the
why-
same when they do hospital inspections.
Yeah.
When they announced they were coming, you never saw so much work going on.
Oh, I know, I
Right.
know. It's like when FDA comes to a device
Yeah,
manufacturer.
everything is
Right.
perfect.
Yep, I know.
So then you go and walk in some night when there's nobody around and somebody
Yeah.
throws you out of the
Then you say,
medicine
"Oh, it
closet
really
and they say, oh, by
works."
the way, I'm from the state. Okay.
Yeah, yeah. So I think she's doing the right
Good.
things. I had a very good
Okay,
feeling
so
about that.
good. All right. So
Now,
that's
the
good.
wastewater, we don't know. What she's doing is talking to Jim, and the reason that this is kind of going back to Neshoba, possibly, or I'm asking Neshoba to look at it, is that the requirement here is very similar to the requirement for permitting for hauling sewage. So if that's something that they do already and they have, if you have if you have your septic pumped and take it away, that the permitting for that goes through Neshoba. So I still don't have.
Well, it
the answer on
seemed
that
as
yet.
though if anybody was from those new regs, which they didn't bother to let us know about, was
I know.
that if you were driving a truck, even if you
Yes.
started in another community,
Yeah.
if you are driving through the
Yeah.
town of Ayer,
I know.
going elsewhere, because I don't think we are accepting any septic here
Right.
anymore.
Right. Yeah.
We're not.
Yeah.
I asked and someone said, well, no, we're not accepting it. I said, well, I think this new rule is as long as they're driving through, they have to have some kind of permit from us.
They have to have a permit, but it has to be issued, my reading of the reg was that it's issued by the town in which it originates.
Yeah.
But they have to show that permit to whomever they ask along the way.
Yeah, see, it was kind of not clear.
Yeah, if they don't come up with something, my backup is Mac Wetzel, who said that he can give me something that would help. But if it's something that kind of falls under a nice package with things that Neshoba already does, that would be fine with me.
I've never heard that mentioned, but that's all right.
No, we may
It's
have
something-
to still adopt a regulation.
Yes.
But the permitting might be something that we can do in a manner that's similar.
So
to
what is typically considered wastewater? There's a difference between, like you said, sewer hauling and
Yeah,
wastewater
there's
hauling.
a definition in the regulations, so it describes it, and
Okay.
so I think it's nasty stuff that's not quite sewage.
Mhm.
Yeah. Probably a lot of the stuff, for example, if they were taking away in tanker trucks the stuff from Nasoya.
That's what I was gonna
That
ask
would, I
next.
think,
Yeah.
be typical.
Yep,
Yeah.
because that would be quite a bit.
Right.
Because they're upping that operation by how many?
Yeah,
Yeah.
yeah. But they also had their permit for the amount that they discharge into the piped wastewater system in Ayer increase.
Right.
But still, yeah, anything that goes above that permit, they would
Mhm.
have to take away somehow. So I'm definitely going to follow up on that one because I don't want it to go.
No, we should kind
Forever.
of star that so
Yeah,
that we
yeah.
get it done. Because once
I have a
the
circled star.
Yeah.
so-
once the fall comes,
Yeah.
you get busy with all that kind of stuff, and things can fall by the wayside. So
Yeah, I'd like to kind of have that.
Get that
one.
out of the way,
Yeah,
yeah.
I'd like to have
Yeah.
that one wrapped up too. Okay, ongoing business. A couple of them are very fast. Administrative wrap up for 41 East Main. I just wanted to keep that on the agenda one last time because I wanted to just mention that I did have Carly and Robert review it more from the standpoint of is it worded correctly? Are the restrictions that are in there as far as these requirements following the deed and the additional documents that have to go along to tie in the operation and maintenance? They were fine with it. So that was signed off today, and that will now start its 20-day appeal process. Now, I did notice, which is interesting, that it is on the agenda for Thursday night's planning board meeting, and as of when they put up their agenda, they didn't have our special permit in hand. They had our verbal. So you probably, Jane, want to get just a copy.
I'll send
the
one to Jim.
Final thing, over to them so they've got it for Thursday night. And apparently the evolving cannabis laws are still evolving because the House and the Senate still have not agreed.
Well, they're fighting.
Yeah, they're still fighting. Yeah. But for a while there, they were saying it was inextricably connected to the budget. You could not separate this bill from the budget. You couldn't have a bill unless you had a budget. You couldn't have a budget unless you had a bill. And then somehow miraculously it became less inextricably connected.
And they
Because
wanted-
There was
now we have a budget.
problem with the budget when they put in the $30 million raises for them.
Yep.
So just keep remembering that.
Yep. Oh, I remember that every time I write my tax check to the state.
And now they've come up, the little mischief makers that they are. Tell us how you really feel, Mary.
Yeah,
Don't
be
hold
honest.
back.
Don't hold
back. Well, today I read that 2 bills have been filed with regards to sugar. We're now going to be the sugar police.
Yeah.
So if you buy X can, then will be this amount, but if you have a bigger soda bottle, well, then you'll pay 24 cents more. And then, of course, the schools will have to watch this. Now, the teachers don't have anything else to do with all the rules and regs. Now they can watch to see if maybe the parents are sending the kids to school with soda instead. Oh, yeah. There were 2 bills filed today or last week, yes, with regards to, they've tried this before.
That's just what I want our teachers doing. Watching
Absolutely.
what size.
They don't have enough right now with
Right.
everything, but that was filed. But we haven't done anything with the cannabis. And my concern not is what they're doing, more are we going to end up with that body that got that law coming back with another law because you're not following, apparently the group that did the citizens petition felt that the Senate followed pretty much what they want, and the House rewrote the whole thing.
Right.
Well, it's a mix because the House, I think, had the
28%.
lower or higher
28%.
tax,
28, yeah. What was the number?
but the Senate version is the one that gives the decision for whether you can block having such a shop in your town to selectmen and city councils.
No, just
rather
opposite.
than-
The
Is that
Senate,
right? Is
yeah.
that the other?
Which
okay,
surprised me
okay,
because
okay.
usually the Senate is much more liberal.
You're right. That's right.
And they
Yeah, that's
pretty
right.
much followed it and said, the residents of the town can decide.
Yeah.
And, oh no, the House said, oh no, it'll be either the city council or the 3 or 5 member board of selectmen or
Yeah.
whatever the governing body is, and not the residents of the town. And see, personally, I always have felt that it should be people living in town.
Yeah.
You know, if you want to have it, vote on it.
Yeah.
You know, if it's at a town meeting, then get your anatomy to town meeting and
Yeah.
don't whine and
Right.
complain
Exactly.
afterwards.
Right.
I don't feel that, and I feel the same way with as far as liquor laws, giving liquor licenses.
Yeah.
I think that should be the town.
Yeah.
And if the town says we should have 10 more full-service restaurant liquor licenses, then we should have it.
Yeah. think
I
so.
don't think a group in Boston should decide
No, I
that.
don't think so either.
Right.
Well,
So-
we'll have to see if they get nice with one
Just
another.
gonna keep
Make
going,
nice
going,
or
going.
yep.
One of those things.
Another to be continued. And I have
Yep.
not heard anything new on smoking age. I
No,
have
that
not
seems to
seen
have been
her.
lost in the
Yeah,
whole.
yeah.
Decide because of the
Yep.
other one.
And they probably should be deciding on this cannabis thing because that actually has a date that is rapidly approaching. So.
Well, remember when it was first, when the medical marijuana was first brought forward, some of our reps were here and said, that's a long time
I
off. We
know.
don't have to make any decision.
Yeah. And in
And
terms of the legislature,
And then when it came forward,
it's a
it was
very
like,
short time.
oh my gosh,
Yeah.
oh, we have to do something.
Yeah.
Hello,
I know.
hello.
Right?
I think that the medicinal marijuana had a lot more, it was more a data-driven thing. I mean, we
Yeah.
had all that.
Yeah.
And it had been, proven in so many different venues. that
Yeah. Exactly.
could be helpful for this and that. The recreational one, that's a different kind of usage altogether. So
Yeah.
I think that's why that was quicker to
Well,
get into.
Yeah.
Oh,
Actually,
even
it
that
wasn't.
wasn't very quick.
No, but I mean compared to
well,
this.
what I'm saying is the medical marijuana, they had all the towns that passed it and everything. The state didn't do their job. It was all of a sudden they were supposed to approve in that first year 5
Yeah.
in each county. We didn't even, I don't think they did 5 in the whole state. It was just, oh my God.
In that first pass?
Yeah, it was
I know it.
ridiculous.
They dithered around. I know. And they're dithering around again. So
And
we'll
it-
see. I wouldn't be surprised to see something on the
I
ballot.
wouldn't either.
Not at all.
No, next year at all, because they're just kind of sick of it. And I can understand, it's a lot of work to do a
Well,
citizens
exactly,
petition. And generally, they kind of thumb their nose and come up with some other kind of legislation,
that's the
and
thing.
they don't listen
The
to the
Commonwealth has
voters.
already voted on this. So,
Well, it was getting the
Yeah.
income tax down. That was in
Yeah.
2000. Here it is 2017. We're not at the 5%. We're like 5 point something.
I
And they're
know.
trying to figure
Yeah.
a way that they can shoot that back up too.
yeah.
So,
To be continued.
yes.
We will continue to keep an eye out. So, tell us about opioids. and
Well, I did,
what's going
I
on.
think I sent Jane a link to that article that had been in, tonight, it was, you probably
Oh, I
haven't seen it.
Yeah, I didn't see mine yet either.
It's an old article that was in the Neshoba Valley Voice about the group in and it's SHARP, SHAARP. And of course, when I printed this out, I could not get all, I could see the first part, societal, I don't know what exactly SHARP stands for, and I apologize for not doing better research, but apparently they had another meeting this past May that was not as well attended from some of the folks that I talked to, because they had it at the church.
Is that group in Shirley?
Yes.
Okay.
Yes. And it said besides the SHARP members gathering with the focus, there was a speaker from COIN, Community Outreach Initiative Network, and Concerned Citizens, and a few others. So this group was much smaller than the one that I attended 2 years ago that
Yeah.
had Jamie Eldridge was there. They had law enforcement there,
Yep.
doctors, counselors, recovering people,
Yeah.
telling their stories, which that's really valuable.
Yeah.
So I spoke to a friend of mine in Shirley tonight, who was on the core group of parents that started this, and she said they were thinking of, she's talking to Sharon Webb, who is one of the counselors in Ayer Shirley. I don't know if I think she's in the middle school. And they were going to go ahead and start something in the same, like fall, like we suggested, September, October, for the school. And I
Okay.
said, well, I told her that I was on the Board of Health now, and I asked her if she knew if the Board of Health in Shirley had any involvement, which they didn't. And she said that she would find out. They were going to try and get on the agenda at one of the school committee meetings and talk to Mary Malone about getting another, I don't know what you call it, another forum going.
Yeah.
So she was going to get back to me and get the names of the people that were at that larger forum 2 years
Okay,
ago, and we could probably connect with them. and
That
find out
sounds-
more information. And she said the key, the best part of the last meeting they had was the recovering addicts.
Absolutely.
She said that they had folks that were like 10 years recovered,
Wow.
had come out of it, had gotten jobs, they were clean, and they got their children back. They spoke to all of those
That's
different.
awesome.
Yeah.
Yeah.
So she's going to get back to me on that. So we did, we had a nice
Good.
chat and we started the conversation. So hopefully September, October, we can get something between the two towns, or at least get that forum up and running again.
Well, we share a school
Right.
history.
Right.
It
Right.
kind of makes
See, that's what Jim
Sense.
said. It usually, if there's a grant, it
Yeah.
goes more, they're getting into the schools.
Right.
yeah.
You want to start in
Yeah,
the schools.
exactly.
Yeah. They had some
Yeah.
interesting comments though about it. Wasn't just they were talking about the prescriptions, how they start a lot of the addiction with the prescription drugs had been traced back to some of these students who had played sports that were hurt.
I did read about that.
And then the other link was the older population of the veterans being treated with opioids, and then
Yeah.
they become addicted. So that's
Yeah.
another population. So it's not just young.
Yeah.
It's adults too that come back and they end up being addicted too. So there's a lot more information coming
Yeah.
out on it. So interesting.
Well, yesterday, was yesterday? Today was such a crazy day. Yeah, it's only yesterday, it was Sunday. The front page story in the Boston
Yes,
Globe.
I have that. Yeah.
Was that amazing or what?
Yeah.
So they'll do these in-depth stories and
Yep.
different things. I don't know if one of you saw it, but they went into this whole business of hooking people with addictions up to go down to Florida to these treatment facilities where their insurance is going to pay for it. Apparently Blue Cross is the insurance they target because they have fairly generous plans. And there was a kid from Massachusetts who went down there and, wound up not in treatment and dead. The treatment facilities never really materialized, but there are these kind of brokers up here that get people and tell it's a great deal. I'll even send you money for cigarettes.
And
Your
they do.
insurance is going to pay. Yeah, and they probably do.
And,
And they're paying a bounty.
There are, and I can speak to that from a personal, that happened in my family. But the other side of that is, if you're over 18, you can't keep track of these people. You
Yeah.
get down there, you think
Yeah,
they're doing well,
yeah,
they're in
yeah.
rehab, you call down, you say, how are they? Oh, sorry, I can't talk to
Yeah.
you, HIPAA laws. And then all of a
Yeah.
sudden, if they don't get through the program and they don't, do well, and they're gone.
Yeah. That privacy
The privacy thing.
cuts two ways, doesn't
And
it?
you can call down and you can talk to the Dade County Police, and you know what they say? I'm so sorry. We are the biggest, rehab state.
Yeah.
And
Yeah.
we just can't keep,
Yeah.
people call down here all the time. My son, my daughter, my sister, my wife,
Yeah.
I can't find them. They said,
Yeah.
we can't, they're adults. Once they leave, they
I
leave.
know it.
And they get lost in the system. So it's tough.
And
I think
that
you're doing the
offer
right thing.
has got to be so tempting to, that we'll take care of it, we'll help you,
Yeah.
figure it out, get
Yeah.
it in there, do the paperwork.
Because they tell you, take the person out of the environment.
That's right.
Yeah.
Get rid of the friends, get them out of the
Yeah,
environment, they have
yeah.
a better chance.
That's right.
And
Yeah,
it's
yeah.
50-50. It's all
Yeah.
50-50.
I also read something, I think it might have been in today's paper in the Globe, about a program that they're doing in, might have been Chelsea or East Boston. And what it was they profiled this one young woman who had been a heroin addict, she's now recovering, had lost her kids, she now has them back, had been homeless, she now has a place to live. And what happened was, it really didn't dawn on me that this could be a problem, but it made sense. That she was being seen or, offered services by one group for the drug addiction. She was dealing with somebody else for the homeless thing. She was dealing with someone else with the kids.
Yeah, yeah.
And it wasn't until these social service agencies started talking amongst themselves and going,
Connecting the
oh
dots.
yeah, her,
Yeah.
we're working with her. So they came up with what to me seems like a slap your forehead moment, where they are sharing this information more widely, I guess, between these groups of people that they're seeing and helping, so that they can get the people that have multiple things going on.
Right.
And there's kind of somebody coordinating.
The network has to be connected,
Yeah.
you know,
Yeah.
all the way
Yeah.
connected.
Yeah, exactly. So, I don't know. There's some good things going on out there, but it's I don't know. It's either not enough or not effective
Right.
enough.
And then
So-
the insurance is a big piece of it. I mean, there's the one in Devon's, there's the one in Wachusett, there's these all,
Yeah.
they're popping up, but they're all private.
Yeah.
And most of these, and I'm not saying most, a lot of these addicts have no insurance or on Mass Health, and Mass Health
Right.
only covers certain facilities for maybe a month, if you're lucky,
Wow.
and that's it.
And the waiting list for those must be
Yep, it's day by day.
unbelievable.
You call for a bed. Oh, we're full. Call tomorrow. Call tomorrow. Call tomorrow. So
That's
It's
incredible.
a crazy process. So we're going to get some more info.
Okay. Good job. Thank you. All right. So we are now back to House Bill.
Okay.
Now
1112.
211.
Oh, 2111.
2111. Is this the same? House Bill or no? I was wondering.
HB 11. Yeah.
Did I transpose the
No,
number?
that's right. It's in the old notes
No.
and it's in this one.
It's
2111?
H1112.
Two.
H1. There's no B. It's just H.
HB.
No, HB.
HB.
House
House
bill.
bill.
Yeah.
House bill.
And
Yeah.
I wrote it down 2111. Was it supposed to be
It's
1112?
1112.
Oh, no.
Yeah.
One.
So,
Did I make
yeah.
a mistake on the
I thought that
letters?
it
That's
didn't.
why I was
Look
wondering.
right to me.
I thought,
Yeah, yeah,
Have
it's
a new
like-
one?
Do we have another one we're completing?
So in those old minutes too, that'll have to be.
Right? House bill.
Yeah.
111.
In the June
Yeah,
26th
yeah.
minutes, it'll have to
Yeah.
be changed too.
Ooh,
That's,
you had
that's just a, just
2111
cross
on
one
the
out
brain.
Right.
and just do
Oh,
that.
yeah.
That's not a big thing.
Oh, no, you
No,
had
you
it
had it
right.
right.
You did have it right there, Jane.
Yeah, it's right there, but it's
Awesome.
just,
Okay.
okay.
So, these were the ones that we wanted to all sign because we're being vehement. So, this one is to Jennifer Benson. We have this one is going to Sheila Harrington because they both air is split. And
Right.
Where you live.
Isn't
between
that
the two of them.
something?
Yeah, I know. Incredible.
You're on this side of Sandy Pond, you're, or wherever.
Still amazes me that we
Yeah.
have two precincts.
Yeah.
Jeez. And this is going to a fellow by the name of Matty Ribble, who is Director of Public Policy and Campaign Strategy with the Massachusetts Public Health Association. And he was the person that the original communication that I received on this said you could contact him, and that you could also, of course, contact your state senator and rep, but that he is working through the Mass Public Health Association to try to advocate for not doing this. So we would.
And that's his name, M-A-D-D-Y-E.
Yeah, I know. I
It's
thought
usually a Madeline.
I know, I thought so too, and then I thought, no, it must be Matty, like
That's
T,
what
but
I
it's
thought.
not. No, it's not. I actually looked him up, so that is correct. Yeah. Believe it or not. Okay, so those are ready to go.
Maybe we ought to, let me suggest, and we give a thought, just following, backtracking on this opiate stuff. So, the Little Devils down in Boston that come up with, 1,200 earmarks and stuff on the budget and then just wring their hands and say we have no money. So instead of wasting it, what we should have is a comprehensive plan, all our agencies working together. We have all kinds of old hospital buildings they've closed. We have, I'm sure the state has many vacant buildings, and let's address them for an in-house place to treat people with these opiate problems. I mean, trying to send somebody, like you say, to Florida or whatnot, what about families that are trying to help? So they could put their selves to better use than fighting over some of the stupid stuff they fight about and talk about and waste money on, when a true public health issue like this, and this is young people. So we'll think about something and then maybe come up with another vehement letter.
Oh, I like that.
To the Department of Public Health or to,
to the department.
I'll take a look around at like that Mass Association of Health Boards.
Yes.
I'll see if they have anything on it. I'll also look up Mr. Ribble's organization, see if they have anything.
And like I said, Jamie Eldridge was at, he's on a state senator.
Yeah, he's state senator.
He was at the other forum that I went to. When and if this, I'm saying when, not if, we get this up and rolling, I think that it's important to have people like Sheila Harrington, like Jen Benson.
But it's
so
got
people
to
can
start.
It's
got to start on Beacon Hill. If they can waste money on this piddly stuff that they do, like I said, somebody gets a plaque on some island somewhere that hardly anybody knows about, but and remember, $30 million for raises, and young people are dying.
I know.
And families are trying to help. But how can a family that is busy trying to earn a living, how can they fly off to Florida to see how their child is?
You don't.
Well, exactly.
The best.
Put them on a plane with a
if we're going to talk about dealing with today's problems, then this is one of the things that, and we have closed an awful lot of state-owned buildings.
We have.
Yeah.
Yes, we have.
They had all those vacancies up in Devon's, all those buildings that people were vying for company space.
I know it. All the state hospitals
that's what I'm saying,
closed down over the last few decades. There's a lot of real estate.
There's a lot of buildings because a lot of hospitals started. Your smaller hospitals started closing and closing and closing because of costs and because of consolidation. If you look around and look to see how many local community hospitals you had 20 years ago, and look to see what you have now. Very few community, they're all for profit.
Yeah. Were you born in the Ayer Hospital? I was. And then there was another one in Groton.
I was the last one in my family of 6. I was born in Emerson, and then my younger siblings were all in Ayer.
Oh, wow.
Yeah. And the one that was in Groton, the old Groton Hospital, that was Montrath after there afterwards.
Yeah, exactly. I mean, is that incredible? What, a hospital in Ayer, hospital in Groton?
Yeah.
And that probably wasn't that unusual.
But they were small, and they,
And you always see,
good enough for having babies.
you see, if you look in the back pages of, say, the Herald, you'll see excess property for sale, and they're taking bids on, this. Well, hello, we have this major problem in the state. Everybody wrings their hands and talks about how many more deaths there are this year over last year, but we're not doing anything. We're just, giving lip service, and nobody's really doing what
that's
they should
also
be doing.
apparent when we hear about, Mass Health. which I think you're right, does cover probably the majority of adults that are in this situation. And they give you maybe 30 days and you're on a waiting list for
It's very limited,
geez knows how long.
limited spaces, yeah.
And 30 days.
Well, it's a promissory thing. You supposedly, if the court orders you, it's for 21 days.
Even 20.
And then after that, it's like a promissory thing that you go into a halfway house or then a sober house. And those are supposed to be paid out of pocket for a nominal fee because you're supposed to be part-time working while you're doing it.
I don't think I could give up carbs in 21 days. Never mind give up,
Yeah.
a
Well-
drug that gets a hold of you like
Yeah.
that. Incredible.
All right.
All right, so we don't have any bills?
No, we did them the last time.
We had lots of bills last time.
I know. Good for you, you're being thrifty.
Yeah.
Well, I certainly hope, however, that you have, I guess this comes under miscellaneous, I hope you have plenty of ink because, just in case you didn't have it, I also brought my copy of this.
Yeah, I have that.
They gotta have that by,
I have to pull all those. Yeah, like,
So this is a request.
I'm a busy girl.
Yes, the law offices of Peter E. Flynn in Saugus, Mass. has requested that we make copies of any and all files, plans, and related communication or information in the town's possession related to, and there's an enormous list of properties.
Oh.
Yeah.
Well, but you need to explain to people that are watching what this pertains to.
Well, it doesn't actually
It doesn't break
say
it down.
what it pertains
No,
to.
the law.
We just happen to know the law offices, this is the same law office that has to do with Mr. Barry and the eminent domain over the Depot Square. However, the letter does not say that that's what it's for. I'm just mentioning that that is the same law office. It could be something
Because we
entirely
did see that right up when it was
Yeah.
in the paper, that they are the office in the state, excuse me, that does all eminent domain things.
Oh, so and that's what these other properties are considered
Well,
under the same.
as somebody explained once, if you don't ask for it and then something comes up, you can't do anything. So you kind of throw a great big net
Yeah.
and list everything within probably a 2-mile radius. And then
Exactly.
then you say, you know what, that we don't need, and that we don't need, and that one we don't need.
Yeah. You can back out.
You
but
can back
can't-
out, but you can't
Yeah.
add in afterwards.
But you can't.
So they want copies.
Yeah, and they have to have this by Wednesday afternoon is the problem.
When did
So,
we get it?
The letter is dated June 28th. I'm not sure when we got it.
We got it last, what is today, Monday? We got it last
Last-
Thursday.
Last week? Okay.
But I spoke to Robert about it.
Okay, all right. got it.
And he said for me to pull the files and give them to him, and he would take care of
Oh, okay,
getting them
perfect.
copied. So I don't have to
Wonderful.
copy the contents. I just have to,
Fantastic.
yeah.
He'll get that done. Okay.
Because, they have to keep track of all the expense involved and the
Yeah,
time
exactly.
involved. So I'm also supposed to log in my time. And
Oh, okay, keep
and
it
how much
separate.
time I,
How much would we have with regards to that? Because we weren't really involved in any of that.
No, but they want everything that has to do with that property.
But
And
what I'm
there's one,
saying
two,
is that we shouldn't, we, the Board of Health, shouldn't have anything because we weren't specific to that project. We had nothing to do with
We
it.
weren't, but there are like 11, is that right? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 properties on Main Street. So some of them might be restaurants where we may have some information.
But probably not a lot, Mary, you're right.
No.
Yeah, 1, 2, 3,
Pretty
4,
much. It
5
shouldn't
of-
be much for
Wow,
us.
I can't believe there are that many. There are actually street numbers, number 5, 7, 9, and 11 Depot Square.
Mhm.
Then there are 10 and 16 West Street, and then the outlier is 46 Washington Street for some strange reason. So anyway, okay, so you got it,
So-
you're on it,
So,
under control.
Like I said, it
I didn't
should
say it was under control, but there,
You didn't say it's under control.
but the selectman's
plan.
office
Yeah.
is monitoring it. This is a very common request in cases like this.
Okay,
So it's a procedural dance,
yeah,
and we do play a role, even though we, maybe weren't directly involved. They're asking for all the files the town has.
Yeah.
So that
Yeah.
includes us, and
It's a splash.
yeah.
Yep, you just have to go through and do it. So,
Okay.
yeah, I'll be doing that.
So we have, here's something that I'm just wondering if it has to be included in that or not. We have property files that are filed by address, and then we have establishment files that are filed by establishment name. So let's say, for example, that one of the restaurants on Main Street is one of those properties. You then, I guess, also have to go to the restaurant
yeah,
file,
that's
right?
my,
So you've
yeah,
gotta,
yeah.
yeah,
So I'm
match
gonna,
those up.
I'm
yeah.
gonna it's gonna take a little doing to
Yeah,
match up the names, because in our filing system, which works great for us,
yeah.
we file under the names of businesses rather than the addresses. So it'll take a little doing.
Yeah.
But not to worry. But it's going to be time consuming, but I will be keeping track of my time.
Okay. And you can get what you need to Robert in time for, yeah, okay.
I hope so. Yeah, last week I didn't have a chance because it was a short week. I only had to go to work one day. So,
Just keep him
yeah.
up to,
But I've already talked to you about it. So.
okay. And then we've got, what, a couple?
That
or
came,
8
and I'm not
checks
sure what
here.
that is. That goes back, I think, to
Yeah, that's gotta go back
to us. No, it's
To
from
us.
Neshoba.
It's from Neshoba?
What is it?
And I'll have to ask Bridget what that's about.
Yeah, this is a check from Neshoba for $20. Oh, food permit refund. Apparently,
Maybe they were applying for a
Black and
permit.
Government, the group, yeah, maybe they just didn't get there or they didn't follow
They got,
through.
yeah, they came in late. So it
Okay.
could be that they paid their fee, but they didn't get
Didn't
their
get it.
permit.
Okay.
Yeah,
All right, that's fine.
yeah. But I'll
and-
talk to Bridget. That just came in today. So.
Yeah, and this thing doesn't really look like, I don't think we need to do a whole lot with this. This has to do with a well for irrigation purposes only. We can put it on the agenda as she suggests for next week, but it's for 62 Wright Road, which would be around the backside of Sandy Pond, and they are drilling a well for irrigation. Actually, they don't need anything from us, do they? Because, not from Board of Health, other than Bridget, okay, because this is not aquifer.
No?
Right.
Yeah,
But I think that we do, and Mary.
I think we do, well,
Wells.
sign off on wells, yeah.
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 And it's a private well.
Yeah.
We don't see a lot of private wells because we have
Yeah,
public water and sewer for the most part.
I think in what we've discussed last year, especially when we were under
okay.
the drought, was when people were putting these in, hello, you're drawing from the same aquifer.
I know,
It's
yeah, it really
it's-
is kind of all the same.
Oh, well, we
yeah.
just got this private well, and it's in, and we can irrigate our lawn. Well,
Right.
you're
No.
drawing.
Right.
It's nice to us, so I think that's what it was.
Oh,
So.
using the same one. Okay, do you have anything for update, Jane?
I don't.
Okay,
I don't.
that's fine. That's actually wonderful. Sounds like things
Do
things are
you
copacetic.
anticipate, Madam Chair, that we will keep our both meetings in August, or are you anticipating that vacation at all, or?
I have dates.
You have, like, you're
August.
going on a date?
Well, no.
Or what do you mean you have dates?
In August.
I just think,
You have a social life? It's shocking.
Not anymore.
I know.
think for clarity that
Yeah.
if we're
We do.
going to be off for a week or something, we could say it now, so
Right.
we
We
know.
do from time to time.
What's the next,
Okay, our next
Would be the
meeting
24th.
yeah, is the 24th. And then when we get into August, we have a meeting on the 14th, which I probably can't get to
I
anyway.
won't be here.
You know what? That is the meeting we should cancel because I have to go to a training in Boston and I'm probably not gonna be back. 14th, August 14th. Unless something of dire importance comes up.
I'm going the 11th through because I don't take any time in July, so we do 2 weeks in August before we go back.
Good for you, yeah. So you're gone the 11th to, when are you?
So you won't be here in August, is basically what you're saying, Trish. No, I'm just trying to
Yeah, I'm going from the
clarify
11th,
things.
from the 11th through the 25th, I won't be here.
Okay, so let me just see, just in case we did have something crazy
Yeah.
that happened. Okay, so you will be back for the meeting on the 28th.
Yes.
Okay, so
Keep
at this point, I think the August 14th meeting, unless something desperate needs attention, and even at that, if something desperate needs our attention,
Well, if
we're
we're not-
probably going to have to do it on the 7th because Mary's going to be by herself.
Yeah.
Well, we couldn't, that's why I wanted to clear it up, because if something came up that we
Yeah.
had to have an emergency meeting, we have to know when somebody's gonna be around.
That's
You know, say, we'll have emergency meeting. Oh, well, Tricia's out of state. Oh,
Yeah,
Pam is.
and actually, I'm really glad you brought that up because
No, I
I
always like to do
needed
that
to mention
ahead.
that I'm going to have a little conflict that day. So, let's go with that we are not having a meeting on the 14th. However, if something that desperately needs our attention arises, we do have Monday the 7th,
Okay.
and
But as-
that would be just a week, no, that would be 2 weeks after the 24th.
But right now, as it stands, we are
Yeah.
canceling our first meeting
Yeah,
in
we are
August.
canceling
So
our
we
first
will
meeting.
have only one regularly scheduled meeting in August,
Yeah.
and that's the 28th.
Yeah,
Good.
but we do have options, if,
Yeah.
It's an
No, just-
emergency.
yes.
Well,
Because
I didn't want to
If there's something
confuse
desperate.
people with that.
Yeah.
That's always an option. If you had to have an emergency meeting,
yeah.
that's a whole different
I just don't want to
ballgame.
make it sound like we're not,
No, but vacations, people do have lives,
we're all
and
going on a cruise.
we don't have,
So the 28th would be that next meeting, August 28th.
Yes.
Okay.
So we're meeting, so our next two meetings then are going to be what, July 24th and August
28th.
Okay, great. So for the next meeting, the July 24th, let's get the minutes from the June 12th, the missing,
Mm-hmm.
the minutes that went missing, and it sounds like lots of us have notes on it, so if, it should be on the recorder, but for whatever
I've
reason.
got
if
it,
it's
no
not,
worries.
yeah.
I think I've done them, but
Okay.
I will have them. I will have the
Okay.
notes, and I can get them off the
Yeah, I
video.
know.
And I'm not worried.
and I'll have an August meeting, I'll have a report from the Neshoba Board of Health, because we finally got a date, which is August 3rd for our
Okay.
meeting, so that
Okay.
I can update.
Okay, and there's no RAB until September. And I will follow up, let's put the local wastewater permitting on the agenda again, and Rock and Roll, AKA Fujang, also on, and I'll just get some info from Bridget.
And let's think about doing something to the state with regards to developing some in-house for opiate addiction. You know, you can do all you want and talk all you want and say, oh, well, we've got people going out, we've got this and we've got that in the big cities, but, you know, we waste tons of money.
Yeah, I know.
So-
True. Although I don't know, having the real estate probably isn't the biggest challenge that they face. It's actually getting people, staffing it and getting somebody that wants to go into that business. and-
That is up and coming.
Yeah, but it is.
Yeah,
But
yeah.
if you don't have some place
It
to
is.
put them,
To
if
go.
you can only
Yeah.
send them to a local hospital for 3 days or something like that, and then they're right back.
We got the fire
The same-
station.
The same,
It's-
you know what I mean?
available.
It's
Yeah. True. Yeah.
we do a lot of talking, and I think what we have problem is there's too many individual groups instead of all working together like you were talking about. Well, this group was, they were talking to her about her homelessness, and another
Yeah,
one was
the
talking to.
Yeah.
You need to all be working as a cohesive unit. You don't need 10 different groups, because by the time you get them all together, 6 months have gone and the person is dead.
Yeah, and that's why I said I will check both the MAHB and also, I want to just make sure, actually I've got these on my computer, but Mass Public Health Association.
Yeah, they must have committees amongst themselves at the Department of Public Health, you know, each department. I mean,
But you
within the department.
Yeah,
But you can't compartmentalize it like they do right now. And what you gave was a perfect
Yeah.
example of it.
no, but what we're saying is if there's something already there, if there's some germ of an idea that already exists within one of these groups,
Yeah.
it's something that we can,
Well, if they have, they're
That would be
keeping
nice.
it quiet, because there's certainly not been anything in the paper other than everybody moaning and groaning and talking about the opiate crisis.
hey, it could be like the local wastewater permitting. That was a whole change to the, Massachusetts regulations, and what do we know?
Yeah, but I don't think anybody's done anything for this, not at all.
No, probably not. Okay,
They're busy though, don't forget that. They're gonna tax sugar.
Well, aren't they on vacation, all these?
It's a gateway
down in
drug.
Boston?
yes, that's right. So, waiting for Mary to make her sleeping bag comment.
Well, no, and I think it's 6:45, so I will make a motion to adjourn.
Yeah, I will second it.
All in favor?
Aye.